Did you know March is National Colorectal Cancer Awareness Month? And with the news of actor James Van Der Beek losing his battle to the disease at age 48, it's putting a spotlight on the importance of colorectal screenings. Joining us now is Chief Medical Officer with DAP Health, Dr. Joseph Aquilina. Welcome, doctor.
Good morning.
Glad to have you. Such an important topic. First, let's start with why people in our community should be screened for colorectal cancer.
You know, the reason to screen really is because colorectal cancer is so preventable. It's the second most common cancer, and if you catch it early, you can prevent it.
Are there no symptoms? Is that an issue here?
Well, by the time you get symptoms, it's probably fairly far along. Still treatable, but you don't really want to wait until you have symptoms.
Right.
You really want to catch it when it's still very, very small, and just the diagnosis sometimes is therapeutic and can fix it.
Okay, when you say treatable, how so? How is this treated?
You get the screening, and then if they find something, sometimes just the diagnosis, just like taking a piece of a polyp, is enough to remove the polyp, and then the risk goes away. There are different types of polyps, and we were saying kind of like moles on the skin, right? Some moles are fine, some moles need to be looked at and taken care of. Same with polyps, and there's no way for you to know if you have polyps at all, or if you do, are they the bad ones that are precancerous? So the best way is to get screened.
When you hear the word colonoscopy, it's like, yikes, you know? I'm 47, I know that I'm in that range where I should get one, and I still have put it off. Are there any other testing options for people who just can't get there yet?
Yeah, we started screening at 45, so
I know,
let's talk.
I know.
Let's talk. And there's a bunch of ways of doing it. The easiest way is a little thing called a fit test. It's a little card, you put a little sample of stool on the card, you mail it back, and it can screen. It's easy but frequent. The next one that I really love for a lot of people, if you're low risk, is Cologuard. Cologuard, yeah. It's a bigger sample of stool. They test for DNA markers of cancer, and thankfully, colorectal cancer has some really good markers that we can screen for easily. That one, if it's negative, is good for 3 years. But the one that really works well, it's a little more effort, is the colonoscopy. Yeah. But if that one's good, you're good for 10 years.
Okay,
so it's
that's
like
encouraging.
You put your work up front, but you're good for 10 years. That's pretty good.
Yes. Now, if someone is watching that has been putting this off, like me, what are your words of wisdom? What do you really want to stress today?
Colorectal cancer is common. It's one of the most common cancers we have. It's very preventable, and there are no symptoms, okay? So definitely if you have blood in your stool or abdominal pain or changes in your stool that don't go away, well, definitely come talk to your doctor. But no symptoms is not no problem. It's usually in the early stages there are no symptoms. So I wouldn't rely on the fact that I feel fine. You still need to screen. That's why we're talking about it this month. Yeah.
Yep. So go get screened.
Go get screened.
Bottom line. Thank you so much, Dr. Aquilina, for all this useful information.
Thank you, Talia.
We appreciate it. Colorectal cancer is preventable, folks, and when it's caught early, it is highly treatable. If you are 45 or older like myself, if you have symptoms, a family history of colorectal cancer, please don't wait on this.
If you think you might be due or overdue for a checkup, the best next step is to talk to a clinician. Call 760-323-9255 or visit daphealth.org to learn more or schedule an appointment.